Welcome to Colors of Perth, where we bring life stories together. My name is Yamuna. Today on Colors of Perth, we meet a woman from the land of Mount Everest whose strength and spirit rise just as high. She began her nursing journey in rural Nepal, where women's voices were often unheard and their health rarely valued. Yet, she served with heart, honesty, and courage, becoming a light for many women who had no one to speak for them. From those quiet villages to international platforms, she has inspired countless lives. She carries the same caring nature as Florence Nightingale, helping people understand the importance of women's health in places where it was once ignored. Even now, while living in Australia, her heart remains connected to Nepal with resilience and purpose. She continues to advocate for women, encouraging them to care for their bodies, believe in their worth, and chase their dreams. In a proud moment for Nepal, she became the first Nepali to represent the country on World Gynaecology Oncology Day, raising global awareness about women's reproductive health and cancer care. Now she is a co-founder of Always Talk, which is a platform to talk about the awareness. She is also the Vice President of Green Youth Foundation, working for people, community and environment. Please join me in welcoming Mrs. Benju Oli to Colors of Perth today. Welcome to Colors of Perth.
Thank you, Yamunazi. I'm really pleased to be here and really great that you called me. I'm really impressed that you are doing so much for this country and bringing someone like me who can give awareness to this nation. I'm so thankful towards you.
Thank you for doing so much. We really need someone like Mrs. Benju Oli to make aware people that women's health are really important. So let's start with your journey back in Nepal.
I started my nursing journey in 2018. I started working in community hospital where I gained lots and lots of experience. I used to work in ICU, then I was shifted to gynae department where I really got connected with women. I used to see pregnant lady all around giving birth and someone with their gynae problem. Being a female, it's natural that we get connected with females, right?
Yes, we can relate to our things to the patient.
And I can see that females suffer a lot. They are always underrated. They go through a lot, and I really connect with their story. Whenever I see face of woman, I can see story behind that. And I used to conduct normal deliveries, and I used to hold that baby. When I used to hold that baby, I know I don't have any tension in my mind when I hold that baby. So this is how my career started, and slowly, gradually, I only started working with females and all around women with their problems, with their history, everything. So this is how I started.
How did you end up in the gynecology department?
To be honest, I'm really thankful towards that person, but at that moment I was really angry with that person, because when she told me that I have to work with a gynae team, I was really upset because I knew nothing. I was so backward in college days that I don't want to work with gynae department. So when she shifted me to gynae department, I was really sad. I couldn't work properly, and gradually when I used to write a lot. I used to write stories and everything. And when I went there, I could find stories in everyone's life. Female giving birth and her husband is not with her. I can see every trouble in their life. So this is how I started.
Any story that really make you feel proud?
Yes, I still remember her. She's doctor, she's dentist. If she's watching this, she will remember everything. She was in that period of life where she was giving birth, and I stayed with her for 23 hours. Like I told that earlier as well. I do have many patients to whom I stayed like long period of time, but that was the longest period, 23 hours straight. So I was trying to give her 100% treatment. That was solely throughout my heart. Like everything, whatever it was coming from my heart. Maybe she could sense that. And I used to keep her with her husband and let them talk, create some sort of love in between them, make them talk about their memorable part of life. I supported her mentally. Like physically she was going through a lot, but mentally I stayed with her, I talked with her. I made her
comfortable.
Made her do things that is fun for her. Like she gave birth, and she till now, till the date, she remembers me, and she have one clinic. And whoever goes there taking my name, she will not take money. When I told her that I'm going to Australia, she cried from us because she is planning to give birth to other child.
Oh.
And she wants me again, but I'm not there, and she cried. So this is the mental support, the only support we can provide at that moment, because nothing, this is all natural process. We cannot pull or make her easy in that way. The thing that we can provide in that period of time is her mental support. In that period, female will be more emotional.
Yes.
So we have to understand how emotional she is feeling, or how her environment is. Is she liking the person who is staying by her side? Being a medical professional, we can tell them to, yes, you can go out. We can act in a different way that health professionals need to know. Let me tell you one thing, very few hospital over there, they conduct painless deliveries. So most of them, they do conduct normal deliveries, but they don't have that facility of doing painless. Are you getting me?
Yeah.
Yeah. So because it is very new for Australian people to know that people are doing normal deliveries without giving painless medications. So this is very new to them. But
so do you mean that because I do not have experience of delivery, so might be I need to know very basic thing as well. So when the baby gets delivered, there is usually two processes.
Yes. Like there is many processes. Like we can do cesarean section, we can do normal deliveries, but in normal delivery we can find two things. Yeah. Like we can do painless and we can do with pain. Like when we give birth, till the end we go through pain. Like lot and lots of pain. Maybe you have heard about that.
Yeah.
But now our technology is getting advanced. People over here in Australia and many developed countries, they are giving deliveries with the help of painless medications. In Nepal, there are a few hospitals, they do give birth with painless medication, but many of the hospitals, they are still practicing the same with pain.
Okay.
So when I do remember one female, she was roaming all around the hospital due to pain. We nurses, we do support them, but mentally they always seek for someone they love, like they want that kind of love. So that female, she was seeking for her husband, and me and my colleagues, when there are females all around, we keep on gossiping and we used to think that her husband is not here, he might be in abroad, but when he came back, he was drunk. We were so sad seeing that guy, and he went to his room and he slept. Like she was roaming all around the hospital.
She was in the hospital and her husband came as a drunk.
Yes.
And once he came, he did not take care of her. Instead,
he was yelling at her. You might not be in that pain. You are acting or you are overreacting. In that way, he was yelling at her and he went back. And that was really painful to see that moment. Maybe that lady stopped crying with that pain. Maybe because of that yelling. They don't know that when they are going through labor, they need lots and lots of love. The only thing that makes her able to give birth is love. And people don't get that.
Yeah.
And we can see all around the world, I must say that, around the world, that people, they don't understand how much this female goes through. Giving birth is not an easy thing.
That's a different story. and in our country, in country like Nepal, when a baby is giving birth, we don't allow male inside the delivery room.
Yes, when I practiced in 2018, I used to hear that Thapathali, one of our famous maternity hospital, they allow our husband to go inside the room.
They started only in 2018.
Yes, and I went to Dubai to practice new setting for this gynae health. And when I came back, I got chance to work in one reputed hospital over there. And everything was in my hand. So I must say I'm a change maker over there. I allowed that husband to come inside to see everything, whatever goes around that female
delivery.
Everything. Like till the end, till the end delivery. After doing everything with that baby, we gave that baby to his hand. He cried a lot, and I know that man, wherever he is, he know how much his wife went through. So I just want to tell everyone that to go and see, to support their wife. So everything about pregnancy.
So you are saying that we still don't have a painless delivery in Nepal?
We do have. We do
Now
have.
we do have.
We do have, but in very few hospitals. Like we cannot find everywhere there. We have to select hospital. Oh, there is painless delivery, I should go there if they want painless delivery. But still, there are lack of awareness. People don't know that there is painless deliveries, and there is so many myths around that when we do that, there is lots of side effect, and we are not. Our country is like, they are really backward to accept new technologies.
So is that the reason that you stepped into the women's health?
Yes. When I used to be in Nepal, I used to counsel them whatever they can do to their life to improve their health or their wellness. I used to do that everything, but when I came to Australia, I got chance to meet so many personalities. They were working only in this area to improve women's health, and I got linked with many projects who are planning to work in Nepal in future. I went with them with few approaches, with few proposals to work in Nepal as well. So in future, we might do something for Nepal as well.
What do you do differently?
For me, giving only medication or doing their vitals is not nursing. For me, understanding them, seeing what they require the most. I always think out of the box, staying in the rules and regulation of hospital. So whenever I used to see the need of that patient, I used to go to the admin. I used to talk with them. How is there any chances we can help that patient? This thing I used to do a lot over there. Like if that patient is financially weak, I used to go to admin. That person who is working in that admin level, they remember my face in that way. Like I used to stand in their door with that paper, waiting for that 10% discount that they can get. Like only giving medication is not nursing. I must say that if you have ability to talk, if you can give something back to them, is the most, I think. Whenever I see patient, I used to see everything, like are they able to buy medication or not, are they able to see for the investigations or not. Like I used to see everything. So this is how I defined me as a different nurse. I do have history of waiting 23 hours in the hospital, not going home, only staying at hospital with that patient. I do have lots of record like this. So I must say I'm a bit different. And whoever remembers me, how is Benju, they do have different story to explain. Like in Nepali I can explain, उसलाई त घरै जानु पर्दैन थियो, उता यही हस्पिटलमै बस्दिन्थ्यो. I do have that kind of story a lot. And
this is your journey that you choose. Do you always wanted to be nurse?
Not really. I wanted to be a forestry department, working in that nature. And my parents, they wanted to see me as a nurse. I'm really proud to be a nurse. I'm really, really proud to be a nurse. Whenever people tell me that you do have that ability to do MBBS or to be a doctor, but I choose to be a nurse, no. Even though I have lots of money, I'll be a nurse.
How women health is looked at in Nepal?
I must say our health system is really good. The way doctor treats or the way nurses treats is different from Western countries. Whoever is staying here, whoever understands the Western style of medicine, they know what I'm talking about. But talking about women's health, it's a bit backward. The main reason is our society is patriarchal society. And even though we want to go to hospital, we want to ask our parents or husband or in-laws.
Story that going through the women's health problem.
We went to health awareness camp, very rural area of Nepal, and We went for this cervical cancer screening and everything, and we found that one of the female was suffering through a lot, and we told her to come back. And we will give her services that she requires for. Go to your husband, ask your family, and let's get treated. We offer in that way, and she didn't came back.
So after she got diagnosed, she did not came back.
Yes, we awared her that we awared everything, like you are going on through a lot. She explained a lot to that patient, like you are going through this.
You have a condition, you
yes,
have a
infection
problem
over
with
there,
yeah.
Many things are happening inside. You like many females, they don't know the anatomy of their body, right?
Yes.
Like these things are there, these things might get infected very easily, or the thing that you are having is like urine infection. Like they don't know what things are happening with them. Like you must have heard about prolapse.
Yes.
We have seen a female putting potato inside her vagina to stop that prolapse. We have seen a lot like this kind of things, and there were, just imagine that smell, that potato, when we took that potato out, what scenarios that was even beyond
imagination.
Beyond
Is that for real?
Yes, that was for real. And these things, being a nurse, I have experienced this much. Just imagine being a doctor or a gynecologist who is seeing only this, how much they have experience about this. Like many female, they come with clothes inside their vagina to stop that prolapse. They are using all lots of things too. But due to many awareness and health camp done by Nepal government, they are using the pessary thing to stop prolapse. Things are improving, but still there are a few places where awareness is still lacking. And I will not blame any department or government, because I will blame the person, the individual person. That person is not being able to speak about themselves.
Why do you think that person is not able to speak about their own health?
I told earlier as well, our society is patriarchal society, right? So always male are someone who is ruling the family, and many females of our early generation, like they don't have money, they don't have employment, the only thing they did was household work or farming things, right? So money, that goes all to the male head of the family. So everything that they require for their health is money, right? First thing, they cannot ask to their father or their husband for their treatment, because they don't keep themselves as a first priority. When they were suppressed from their early age, how can they speak about them when they grow up? So
how do you help those kind of people?
Financially, I have helped very little, like only few families. We have conducted a lots of health camp, where we do screening of women's, like do they have problems with their gynecological health or not.
Do you mean the hospital organize those?
Yes, few camps were organized by hospitals, but few camp we organized with one doctor, she's there, who always loved to do social work, and we used to go with them. And the story that really connects with me is the camp that was organized by Singapore government, or I must say Singapore real estate people. They came to Nepal and they did some camp with Nepalese people. It was a local style. We announced with that mic that we do have one gynae doctor who is here for gynae screening, and these things are done. We will go through everything, your health checkup. But they misunderstood those things, and even male were in that line. And we told them this is only for female. We are here to check their gynae health, how they are going with their gynae health, and different stories were there. We saw their husband supporting their wife, and they brought their wife in that line. and for a few of them they didn't came back for the treatment advice. They didn't came back, and one female was there. We did her screening. Dr. C did her that patient screening, and we found infection, infection. Many things were happening over there. There were bleedings, and that thing was going through from around 3-4 months. And when we called her back with her family to take further treatment in city with that doctor, like she didn't came back. And I went to that house, I called her back, and we counseled her, like these are the things. It might take a big
issue in their life
in future. Yes.
Yeah.
We called her, we counseled her, and successfully we were able to counsel her, and so we helped her. Talking about this health thing, due to lack of awareness, females are always suppressed in that society. From early age, they get suppressed because they didn't get chance to study compared to male. They didn't get chance, so even to access simple amount of money, they have to go to their husband and talk to them.
Yes.
But I must say things are changing. Like our generation, they are well educated. They tell their mother, they tell their sister to go to hospital. If you have any problem, go to hospital. So things are different. things are different.
Used to be different in the previous generations, and it's changing now.
Yes.
Yeah. So what do you think that is the community and the family support really affects the women health?
Yes, 100%. This is the first most thing that we should consider, that we should look after. Like community support and main family or husband support is the crucial thing that women require for. From very early age, we have been studying about the thing that one female or one mother is educated, then whole family is educated, right? That we should take this as a real practical example. If that female is healthy in that family, whole family is healthy.
But so coming to Australia and the things which you have experienced in Nepal, so what's the difference?
Awareness, education. People are more aware over here. People do seek for medical help if they are suffering from something, right? But in Nepal, in rural area, mainly in rural area, where development is still lacking, that part of that area, awareness is very little. Like they don't know even basic things about women's health.
So how do we proceed to make people more aware in Nepal?
I do have a perfect plan because my inner heart is still there in Nepal. To organize a camp over there in that rural area. City area is like well educated, they are well developed. If we compare with Australian people and them, they are equal. Like we can keep them in a
same place.
Same place. So I do have plan of doing organizing camp over there in rural areas.
What would be the first step as an awareness?
Advertise over there in that area where I am planning to do a camp. Not a social media advertise. Because they are very backward towards social media. It might sound very weird to tell people that they are really backward towards social media. They are not like us. We know everything through Google or ChatGPT or everywhere. It's not like over there. We have to advertise with mic and speaker. Pamphlets. We have to tell them that we are organizing a camp. We are bringing this kind of doctor. These doctors are giving this kinds of facility. Is this camp free or we are taking some charge from them? This kinds of awareness is must over there.
Do you think that if we don't say free, there will be less people joining us?
Yes. There is lack of money. There is lack of resources. I do accept that, and that is only because of lack of money. If we will not say them that this is free of cost, they will not come. So there are many sad things to be heard from that kind of society. We have to organize everything free, even medicine, the services we are giving. Like if they come up with if they come up with serious thing, we should be responsible to take them to higher facilities, right? So this thing needs lots of plan, because I don't want to go there and just organize one day camp and tell them that you are suffering from this, go there, or work as a triers over there. I just want to go there with proper planning. Even in the future, if they require treatment regarding that thing that we have told them, we can provide them that kind of services to the end.
Usually, how many people comes for screening?
Very few people. First day, very few people comes to screening, but we do accept that. And for after a few days, the number of people will increase, because the first day people will, that is sort of advertised, right? First day people will go to when they go to home, they advertise. Oh, I went to that camp. There were this kind of doctor. They were really nice, and the number of people multiply every next day. People, they only require or awareness, like how they can maintain their hygiene, how can they stay away from infection, or what kind of protection they can use for their family planning, right? And if they have any serious issues, or they have pain in their certain part of their stomach, they can do ultrasound. Like for one day camp, we don't have this kind of facilities. We always give them number of our clinic or our hospital that is always associated with that camp. But when we go for 3 or 4 days camp, we always request them to do ultrasound, because by seeing their face or by seeing the outermost of the body, we cannot tell anything what's happening inside. So we always request them to do ultrasound or the thing that they are required for, and next day we again go through that if they have any problem or not. If they have any kind of serious issues, first we request them, we tell them charges, how much that is that will require to do any kind of treatment, like if they require any surgeries. We tell them the charges, these are the charges. I never went in that camp where we could provide free services till the end.
Okay, there's always a cost.
Yes.
Yeah. Do you dream of that?
Yes, I do dream of that, because many people are dying because of this. Many families, they even don't know the reason because of their death. The lack of awareness, and people don't organize camp in that rural area of Nepal. It's a huge responsibility. Even though you organize a camp, you tell them you do have this kind of problem, you come to my place, they will not come, because they will think about the money.
Yes.
They will think about the cost. They will talk to their family members, and they might not take that thing seriously.
True. They will just think that I'm still living.
Yes. When you come alone to our camp or clinic, we counsel you, right?
Yes.
You do have this kind of problem. When you go and explain to your family or your husband, they will take your things they will take your thing 10% or 20%.
Yes.
But in that patriarchal society, they might take that they might not take that thing, or
they might not go back home and say anything.
Yes.
Because they might prioritize the family first.
Yes, exactly.
They might say, oh, my son needs to go to school rather than me getting treatment.
Yes. Because I told you earlier, when we had like casual conversations, we female, we think that very personally, and we take decision with our emotions. If we tell them your surgery requires 1 lakh or more than 1 lakh, they will not come. Like, that's true. Even my mother, she will think 10 times
before she spend money on her own.
Even before telling to me. Like, if she knows about her health condition, or she requires money to be treated, she will not tell me. She will think about the money first. Yes. She will think about the circumstances, what thing needs to be prioritized. She will prioritize my tuition fee, my brother's tuition fee, the household thing, and at last we can see in 100 or something, we can see my treatment.
Yeah.
We might not see that also. Even my mother thinks in that way. Think about that people in rural area. My mother is educated. Think about them. They will not prioritize.
How about raising awareness, male side of the family member?
The main role will come to like health professional. Like the health professional, they can always tell their patient to bring their husband. Whenever you come next time for a follow-up, you can bring your husband, so that I can explain to your husband whatever you are going through. You need a big support from your family as well. Even though that's a simple screening, you need to bring your husband with you. If this thing we tell to them, Whenever they bring their husband, they will know whatever their wife is going through. Even in a simple screening, like, oh, this is the screening, okay. This is required in every 3 months or 6 months. Okay, I'll bring her, because they will market that in their mind.
Yes.
Okay, because everything's happen slowly, practically. When this male people, they are very practical towards their life, but we have to make them practical in this counseling thing as well to understand, right?
So husband plays vital role.
Yes, for me, yes. Husband or any family member, they play a very vital role. If they encourage any female of their family, they will 100% take treatment. This is 100% sure. Even if you educate your son, if we will be educate any male member in the family about this gynae health, this will be more effective. They will tell their wife, they will tell their mother, because they love their mother, but they don't know how to love them. They think that giving money or giving some sort of expensive gift is love, but most expensive gift is life, right? If they know how to treat their mother, like if they want to treat their mother in a better way, they can tell their mother to take a treatment in every 3 months, or do simple screening, do blood test. I have seen many children of their family telling their parents to go to take a treatment or something. Same thing I want in that place as well. I know even in that place, their children, they are educated, and literacy level is increasing. Even they can tell their parents to, but it's really hard. It's really complicated for them to take a treatment, because even literacy level is increasing, the economic level is decreasing in the same way. Everything revolves around money. They want to take treatment, there is no money.
Yeah.
They will think about their family only because of money. This family, they will not give approval for the treatment only because of money. So everything revolves around the money.
That is what Nepal is lacking. What's your plan towards Nepal?
I do have that many projects. I will say that, because many people are supporting me. Australian people are supporting me. I do have certain group of people who are organizing to do a camp in
Nepal?
In next year. Hopefully in next year in Nepal. The group of people who are supporting me, they are planning to go in person.
Mm-hmm.
They are not planning to organize by telling someone to do over there. They are planning to do in person. So yes, that group, they just need the experience that I have to guide them, like how can they execute this plan. And yes, but for me, if I'll not be able to go there in person, I'm planning to do something to advertise those kind of camp virtually. Yes.
Okay, so you have so many things in mind.
Yes, many things in mind, but the only thing that comes up in first place is how we can execute that plan.
You need the finances.
Many people are there who are supporting, but we still require, because it's not that we are giving 1 day or 2 day camp. We are just giving them their whole new life. So to give them their whole new life, we need lots and lots of money. Yes, financial thing, we are stuck in that.
See, what kind of people can help you?
It's not that only financial thing that they can help us. They can help in different way. They can do advertise. They can talk about it. If they have connections in that place where they can talk to that person or that community people, they can do that. So people can help in a different way financially. If they want to help us financially, it's not that one person is collecting a money. So we do have that kind of group who is collecting our money, who are registered over here.
As being a nurse, what would you advise to a young nurse?
I would advise them to be emotionally, physically, and mentally strong. I know there are lots of problems even with the salary thing and everything, but don't reflect that to your patients. Love them, care for them. I know many patients are agitated. They might scold you or talk bad to you, but remember one thing, that we are a nurse, we are a caregiver, and we are here to give a care. Even throughout my experience, I have seen lots of agitated patients or patients who are not interested to look at my face as well. But you have to cope that in a very easy and a professional way. So I would like to request every nurses and every health professional understand their patient, love them, care for them. They are in the hospital or in any medical center for their care, for their betterment. Being a nurse, I'm working for an awareness of women's health. Being a single person, I'm doing I'm not doing a lot. I'm doing as much as I can. I want your support in a way that you understand what women's need, understand whatever scenario is going around, counseling, the thing that we mentioned earlier, how you can educate their families, their husband, or everyone surrounding them, also educating them. Always remember one thing, that we know a lot in front of them. If you try to explain in a way that that person knows already, they will never understand. Always try to explain in a way that they do have zero knowledge in that field, and they require lots of education in that field. So counseling is must. I'd like to request everyone to come together to raise awareness in women's health in Nepal.
After this beautiful conversation, I realized that there are so much lack in Nepal regarding women health, and we are so much back in the community, society, and the awareness of the health. So I believe that after this conversation, most of us knows most of the things which are going back in our country. And I personally would like to help Miss Benju Oli in her journey to raise awareness towards women health. I don't know how I can support her, in what way, but I will do whatever I can, and I believe everyone should do. And thank you so much for doing such a wonderful job and putting yourself in front of everyone and raising awareness about the women health. Really thankful that you came here and had a chat with me.
Thank you so much. Thank you so much for inviting me. I'm so glad to be here.